Dr. Vergés asked me to make such a difficult exercise of conclude such a fruitful morning. So for me, it will be more some personal ideas that I got to take home. In fact, I really have learned many things. From the first table, I got the idea that we are in front of a new paradigm with the open access publication of research. I haven't been aware of the changes since I started in the field of medicine, that now the flux of information of the results of the studies and of the creating hypotheses has increased enormously and reached everybody, all the steps of the society. And the open access publications have played an important role, because now I understand that patients are not involved only in the aspects where I started to work on many years ago in the clinical research ethics committees. I was in the first ethics committee in Spain that incorporated a patient in my committee, with a lot of reluctance of many colleagues. It was a success, as it has been a success, the participation of the patients in all the steps of the drug development. And that's what I got from the first table. Because not only in the review process, but also in the pre-review, and as Professor Mobasheri just commented a few moments ago, as hypothesis creating. So I think this is really important. Also, another idea that I got is that the example of the commissioners, or the example that Mabel put on the commissioners on cystic fibrosis as a patient way of intervene in the decision, in the designing of hypothesis ideas, is again in the same path, in the same line. David commented very much on how to improve these commissions with working groups. Patients participants is not only important in publications, but also in the design and in the strategies of research. To improve the research now, it's a must that we incorporate the patients' and participants' voice since the beginning in all the steps. And I think really in the field of rheumatology in general, that OAFI can play an important role, and it's an important task for the future to be involved in all these steps of the drug development process. The second table was a comprehensive explanation in detail of the condition, of the state of the art of the osteoarthritis by Professor Mobasheri. I like especially the inverted pyramid that you show, also with a good explanation of the tools that we have nowadays, quite poor tools if you compare with other conditions, but with the hope that new compounds and new technologies, as the mRNA vaccine could in the future help to find solutions for the condition. Apart from the classical, not recommended treatments, acetaminophen, paracetamol, opioids, and so on, I think that COVID has got the opportunity to illuminate a new focus and direction. Also, I like very much the role of the microbiome as a tool of improve a condition that apparently has nothing to do with the bowel, as the osteoarthritis Later on, late comment a very comprehensive strategy of their fight against the barriers that osteoarthritis patients have had during the pandemic of COVID-19. The Alliance resources have been different, supporting information, patient resource portal, support groups in Facebook. All these new technologies are here for us to be used to improve the condition of our patients. Aina from OAFI explained the 4 research lines of their activity. I like especially the way she divided the lines: own research, European projects like Preventomics and Triangle, and finally international projects, as if we all will be only Europeans, what I like. Also, their participation in clinical trials. I'm aware that you are involved in different trials. Some of them I know more than others, but at least for one, I am very optimistic about the results. I know you started recently recruiting patients. For recruiting, OAFI is basic, is a key point, because as all we know, one of the weak points of clinical trials are always recruitment. And organizations as OAFI are crucial for improving the recruitment of patients that, as trialists, we used to say is the weakest point, because most of the trials fail because they don't succeed in recruiting the patients as needed in time. From the third roundtable, which I was more familiar with, I listened what Natalie and Anna spoke about the efforts by FDA and by EMA and all the work that has been done in the last years to improve patients' participation in the registration process. I was a little bit critic there with some examples that show my bias that comes from my involvement in this area many years ago. Things have changed, probably. Things have changed quite much. And now I think that the emotion of patients participating in such a setting is balanced. It should be balanced by a reasoning and a schedule of reasoning the steps to find out the efficacy and the safety of products, putting a little bit aside the emotion that is necessary from the patient's point of view. And apart from that, with César, I think that César have described very much the efforts of the Agencia Española del Medicamento en Productos Sanitarios in relation to patients' participation. In this field, I cannot say much because I have been involved in the beginning of the efforts of the Agencia, and my role here is only to congratulate the work they have done during these 20 years by incorporating the role of patients in the everyday tasks that the Agencia has in Spain and elsewhere. So these are my main points that I come with them home, my main ideas that I have learned this morning. That is quite much. So I really appreciate being here as a chairman or as moderator, and just thank you for invitation, and I hope to be here next year. Thank you.
Well, Xavi, the pleasure is us that you have a pleasure to have a person like you, with your knowledge, to humanity and a lot of issues. Thank you very much that you stay with us today, and we really appreciate that you stay. And I completely agree with your conclusions, no? Completely agree. I think you mentioned about the clinical trials. From OAFI, as a patients association, it's mandatory to make, knowledge for our patients, because it's one of the problems that we have in OA is that we have a poor treatments. That means that it's very important that to participate in clinical trials and knowledge and everything. That means that we are, this is one of the issues, no? And well, for the last table, I can say that, in fact, we are patients, and, it's very important, the voice of the patients. And today, as you mentioned, it changed a lot. And we have the expertise from the Arthritis Foundation, the expertise from the French Patient Association, Italian, no? And I really appreciate that you stay here, and the work that we are doing, it's very important, and I think it's sometimes difficult. And the COVID was so hard with associations of patients. We know experience about that. And it's very important to survive the COVID, that the patients associations, they are doing it. And probably not too much people know the work that the patients associations made during the COVID area, because we support, a lot of people with a lot of problems, no? That means that it's clear today that, for me, is that the patients associations play an important role in health. I mean, it's impossible to think some meeting without patients today, because the patients play an important role with the health national system or whatever. I mean, that this is a very important change. And of course, that for us, as a conclusion of the table, I think is that the initiative that we have internationally, that Statates Task Force, is very important, no? Because we can exchange information, we can work together. I think this is very important, and we will do in the next month and next years. That means I am very happy. Well, for the conclusion, or maybe the close ceremony, is that the time goes faster, pass faster. We started at 9:30, and it was so faster. And I would like to thank you, for you as a chairman, and later all the 12 participants would take knowledge that it was excellent, and I am very happy. I can say that never I can pay the people that stay with us sharing their expertise, and some people stay with us, other people stay out. I think the 4 tables are excellent, can help a lot of people, because I learn. I am 20, I can say, I have 28 years working as a medical doctor, no? And of course as a patient, no? And I learn a lot of things today. That is fantastic, no, for me. I appreciate all the people. I appreciate the attendees that will be here. Reminder that everything that is recorded and will be in the 25th of this month will be in the YouTube channel, in order that all the people that is interested in the different tables could be go into, and could be, to know exactly what we discussed this morning in the OAFI Congress. And for us, is that it will be all the morning of the 25th. For us, it's very important that to create, as I mentioned at the beginning, an atmosphere that the patients on the center, really patients on the center, and also working with health authorities, working with people from medical doctors, nurses, physiotherapists, all the people involved in the field of osteoarthritis, to work with pharmaceutical companies or private companies or national health systems, whatever. I mean, this is very important. We must work together in this disease, because in case of Spain, probably in some years will be the first country more older from the world. Now we are the second country more older from the world. That means that the problem that we have on our joints, especially women, it's very important. That means that our work can help, and I think we can do issues to improve the quality of life of the patients. And that's all. And thank you very much. and I appreciate, and see you next time.